Hi, super excited that you're pursuing weight loss with an injectable medicine strategy. I'm going to show you what you need to do. Now, from the compounding pharmacy, you will get a packet like this. It'll come from us, and in the packet will be the medication itself. There'll be syringes that you'll need, and there'll be an alcohol swab. This is 4 of them, and I'm going to show you how to use them here in just a second. So I'm going to set that aside. For the purpose of the demonstration, I'm just going to use saline, and the needle will be the same. So this is what you do. Go to the sink, wash your hands thoroughly. Antibacterial soap is fine, pat dry. This must stay in the refrigerator, so you'll take it out of the refrigerator before you start, put it on the counter, go wash your hands, come back, and now we're ready to go. Take your alcohol swab, open it, clean the top of the container. Now we're going to take the needle. There's a back stopper, we'll take that off, and then we'll take the tip off, exposing the very, very small needle. What I want you to do is very carefully you're going to insert the needle through the rubber stopper, like so. Goes very easily. Now we flip the bottle over. There are markings along the needle. These markings correspond to the dose that you'll need to give yourself. Based on where you are in the arc of your weight loss journey, you may give yourself anywhere from 5 units all the way up to 20 or 30 units. It just depends where you are. We will tell you, and it'll be written down for you as well. What you're going to do once a week is you're going to draw up, so I'll just draw up 10 in this case. Now, if there's a large air bubble, now just tap it out, but now I've got 10 units. Okay, I'm going to take this out, and I'm going to do it very straight. Next, what I'm going to do is I'm going to hold my shirt up, and subcutaneous injection is any place that we have subcutaneous tissue. In this case, I'll use my belly. So I'm going to clean with the alcohol. I'm then going to pinch between my fingers, and I'm going to take the needle and I'm going to go straight in. 1, 2, 3, straight in. And I'm going to give myself the injection. This is just saline. There we are, there we are, there we are. Okay, come out and we're done. Next, we're going to take the needle. We will put a cap back on it, and then we're going to dispose it in a water bottle or some sort of safe sharps container. A thick-walled plastic bottle, an old detergent bottle is fine. But something that protects anyone else from getting stuck with the needle. Don't just throw it out in the trash, please. Thanks so much.